I don't have any conflict of interest. Before we start, I would like to take you to a normal optic disc. A normal optic disc has well-defined margins. The neuroretinal rim is uniform, is pink in color. It has a central cup. These are the normal vessels. In majority of individuals, the vessels have pulsations and the nerve fiber layer is transparent. This video shows you normal spontaneous venous pulsations. These are seen in majority of normal individuals. A true optic disc edema is an edema because of axonal swelling. The basic pathology is axoplasmic stasis that causes swelling of optic nerve, retinal nerve fiber layer, and that is a true optic disc edema. When the disc edema is not because of axonal swelling, it is a pseudodisc edema. So we'll have to differentiate whether it is axonal swelling that is responsible for disc edema or not. And the term papilledema is reserved for disc swelling which is caused by raised intracranial pressure. And a pseudopapilledema is called when the disc edema is not because of axonal swelling or raised intracranial pressure. So when we see optic discs like this, it is very easy to say that this is swollen disc and this is most probably true disc edema. But when we come across discs like this, then we have to scratch our head. It is most difficult and we have to play a major role in situations in distinguishing true from pseudodisc edema, especially an early edema from a pseudodisc edema. The reasoning process actually starts from the patient's presentation and we have several clues there which will come across as the course evolves. Here I will concentrate on the optic disc signs. So when we look at the disc, it is very essential to take a stereoscopic view of the disc. So you should take one of the lenses and not direct ophthalmoscope. So when we talk about optic disc examinations, we all know that we apply certain headings and generally these headings are described in terms of glaucomatous discs. But I would like to show you how the same headings are even applicable to non-glaucomatous or neurological optic discs. The first parameter we look at is the size, shape and margin of the disc. Here I concentrate on the margin of the disc. Look at this disc which has a blurred margin. The next parameter is look at the neuroretinal rim. We talk about the color, contour and the cup. The contour is more important in glaucomatous discs where we look for notches. In case of non-glaucomatous discs, look here, the color of the rim is pale. This is very much in contrast to an glaucomatous disc. Here the rim is pink and here the rim is pale. And because of the swelling, the cup is obliterated. The next parameter is look for optic disc hemorrhage. A splinter hemorrhage like this can indicate glaucoma. Similarly, in non-glaucomatous disc, there are hemorrhages, there may be hard exudates, and the pulsations may be absent if there is raised intracranial pressure. And lastly, we look at the peripapillary zone. In a glaucomatous disc, we look at the RNFL layer, RNFL defects, whereas in a non-glaucomatous disc, we look for the opacity or swelling of retinal nerve fiber layer. When there is axonal swelling, the nerve fiber layer becomes opaque. And this is a case of very early papilledema where you can see that at the poles, the nerve fiber layer is opaque. It is not transparent. And that indicates you axonal swelling. This is a late case of papilledema where these are patterns lines. So these are the parameters we look into the optic disc and to see whether it is a true or pseudodisc edema. These discs are from a female who is 47 years old and she complained of blurring of vision in her left eye for past 4 months. Her vision was 20/20 in both eyes and discs were like this. Now both the discs are swollen and we will apply our template at this situation. We look at the margin is blurred The neuroretinal rim is pale, the cup is obliterated, and the vessels are obscured because of the swelling of the retinal nerve fiber layer, and the nerve fiber layer is opaque. So this is a true optic disc edema when we apply our template, and this lady has benign intracranial hypertension. Now this is another patient with benign intracranial hypertension, a little chronic papilledema, where we see long-standing exudates on the optic disc surface. This was a young hypertensive male. We see changes of hypertensive retinopathy. Both the discs are swollen, they are pale, the nerve fiber layer is swollen, there are multiple hemorrhages, and there are multiple vein occlusions and hard exudates. So this patient had grade 4 hypertensive retinopathy and he was on antiretroviral therapy. These discs are from a young lady who complained of sudden decreased vision in the right eye for past 4 days. Now compare her disc. The right disc has very mild swelling, but you look at the nerve fiber layer is opaque and it is swollen. This is the other eye disc. The rim is pale, the axonal swelling is there, and the nerve fiber layer is opaque. It is not transparent. So again, this is a true disc edema. This is another typical example. You have sectoral swelling in the disc and a macular star. So this is typical of neuroretinitis. Let us take some difficult examples now. Now you see this disc. Margin is clear, maybe slightly opaque here, but more or less we can make out the margin. The rim is okay. This is an photographic artifact. There was no pallor here. The rim was alright. And you look at the nerve fiber layer. The nerve fiber layer is elevated here. So this nerve fiber layer is prominent. But now the question is most crucial, whether it is transparent or opaque. I show you another disc. Even this disc has similar amount of edema, early edema, and you see that the nerve fiber layer here is opaque. Go back, this disc, the nerve fiber layer is prominent but it is transparent. So this is a pseudo disc edema. The disc is obliquely inserted. That's why this nerve fiber layer has to heap up or to climb up to reach the surface of the disc, and because it is transparent, this is a pseudo disc edema. All other parameters of optic nerve examination as well as functional examination were normal in this patient, whereas this patient has early true disc edema. Now let us apply template here. This patient has a swollen disc, but the margin is clear. The neuroretinal rim looks pale, there is no cup, but you can trace all the vessels from their origin throughout their course as they traverse the disc. The nerve fiber layer is heaped up, but again it is transparent and not opaque. So again, this is a case of pseudo disc edema, and this patient had optic nerve drusen, which was picked up on B-scan examination. These are another examples of pseudo disc edema. This we often see. A classic disc at risk is the one which is a small disc, and this disc is prone for ischemic optic neuropathy. Now because the disc is small, you may have obliteration of the cup, and you also may have heaping of nerve fiber layer that is classically described as disc at risk. But again, the nerve fiber layer is transparent, not opaque, and that's why this is not disc. It is not disc edema. If at all you are confused, then it is not a true disc edema. Similarly, a hyperopic disc may look swollen because again it's small in size, but when you put all these parameters, you look at the transparency of nerve fiber layer, it should be transparent if it is a pseudo disc edema. This is another young person, and he complained of gradually progressive slow decrease in vision over past several years, and you see that here the margins of the disc are not clear, they are blurred, whereas in the other eye the disc margins are clear. The neuroretinal rim is pale in both the eyes, and here you see that the nerve fiber layer is opaque, it is obscuring the blood vessels, but this is classic myelinated nerve fiber. and there are no other signs of optic disc edema. There are no exudates, there are no hemorrhages, and the disc is not swollen. So this is myelinated nerve fiber. Again, it shouldn't be confused with a disc edema. This eye has hypotony maculopathy, and because of hypotony, again there is axoplasmic stasis and there is disc edema. This is an example of true disc edema seen in hypotony. So in the end, I would like to summarize the issues. When the question is distinguishing true disc edema versus a pseudo disc edema, the parameters which are most helpful are looking at the peripapillary nerve fiber layer, whether it is transparent and opaque. You should look at the disc vasculature, whether it is obscured or you can trace the vessels. You look at the pulsations. The pulsations are absent when there is raised intracranial pressure. And you look at other signs of edema like exudates, cotton wool spots and hemorrhages. Thank you for your attention.